Yeah.
That's
okay.
much better.
Good.
Yeah.
Hello, everyone.
Hi.
I'm here in London together with Tina. Tina is hypnotherapist and
Yes.
a master trainer of NLP, and we are bringing a special surprise to Slovenia. We are bringing a
Diploma in clinical hypnotherapy to Slovenia, and I'm really excited about this.
Yeah, so in 2019 we will have Tina coming to Slovenia, and tell us a little bit more about these studies and why is this beneficial to anyone who would like to become certified and get this diploma.
Well, a brief outline as to how I put this all together, Alex, because when I first did my very first NLP training 21 years ago, I then wondered, what am I going to do with all these skills? So I went and I did a course, I did a diploma in clinical hypnotherapy, but the two didn't really go together, and it didn't really help me very much. And I spent a long time figuring out how to put the two things together to create a really successful, resourceful business, working with clients and achieving amazing results. So now I'm teaching you how you can do what I do and how you can combine your NLP and hypnosis skills to help people with all kinds of issues, from obsessive compulsive disorder, working with depressives, helping people with hypnotic anesthesia, you name it. Once you've done this course, you'll be able to deal with it.
Okay, so let's see. So some people are now watching us, and they may have some questions, but I have some questions to start with. Maybe why would somebody want to learn this and also get this certification, which is actually in UK equivalent to a bachelor's degree?
It is, yes. Within the UK, once you've completed this course, it's the equivalent of 360 CAT points, which is a Bachelor of Science degree. But you get the initials DIP, HIP, DIP, HYP after your name when you've completed this course. I mean, for here, it's accredited on many different levels, so it enables the people in the UK to be recognised by the National Health Service and other people, because it's the things that we teach enable you to assess what your clients really need and the best way to help them.
You say that people will get some knowledge which can help clients, like working with one-on-one and one-to-many, but what specifically is this diploma really about?
The diploma is about enabling you to utilize your NLP skills and your hypnosis skills to help people make changes. And I mentioned briefly the different elements that we cover. We also, and we're going to be covering in England in a couple of weeks, how you work with addictions. So the people that come on that weekend will get strategies that will help people overcome coke addictions and heroin addictions, as well as alcohol, smoking, and also some of the other addictions like pornography, gambling, shopping, you name it.
So it's an incredibly wide usage of hypnosis.
It is. It covers everything that anybody would come into your office to ask you for help with. So you could have somebody who wants help, for example, getting pregnant. We even cover different strategies for helping people improve their fertility. I've had amazing success with people who medical doctors have said they need IVF, and after I've seen them for a couple of sessions, they've actually conceived naturally. So we even cover hypnotic fertility.
Wonderful. So let's talk a little bit how we're going to make this happen. So anyone who would like to join us, and this is now, we talked a little bit with Tina how to make it, needs to have a practitioner of NLP,
yes,
a practitioner of hypnosis,
yes,
a master practitioner of
yes.
NLP, and master practitioner of hypnosis. 4 courses. And then what follows?
And then I will come to Slovenia and I would teach you the change work piece, and I would teach you the strategies that will enable you to literally, it doesn't matter who comes into your office, or what you are asked to help them with, you will know exactly what to do and how to proceed, and be really successful too, because that's important.
Yeah. So for our students, so students who finished NLP practitioner, master practitioner of NLP, hypnotic practitioner, and hypnotic master practitioners, we know the curriculum, and we will have 3 more additional days with Tina, and Tina will teach you actually very much in detail all this change work.
I will.
Yeah, so we will go case by case from addictions, like you mentioned,
Yes.
from fertility, or any issues that we have, and we will have different cases for this, is especially for therapists or people who would like to become therapists in this case.
And they need to do some research too. So
Okay.
they'll be writing assignments.
Yeah.
So I will
Yeah.
send Alexander the different assignments that they need to research and look into.
Yeah.
And all of this is then examined by the General Hypnotherapy Council. They set an exam that you sit, and then they will also mark the exam.
Wonderful. Maybe tell us a little bit about this research. What are different topics that they can choose from? Or?
Well, they're topics that are all about psychological behavior. So, for example, one of the assignments that you'll be asked to do is to write a paper about behaviorism. So, to look at the work of Pavlov,
Okay.
which, of course, in NLP speak, we're talking about anchoring and how you can collapse anchors, how you can create anchors. And we also look at the work of Freud, Sigmund Freud, and Adler and Jung, and how their theories and methodologies translate into psychological methodologies today that help you with your change work with your clients. So once you have an understanding of the background and the theories behind why the people have the behavior, it's much easier to put together the NLP techniques and the hypnosis to create change.
Yeah, so wonderful. So one of the things is that will follow, so people need to finish the 4 courses, so practitioner of NLP,
Yeah.
master practitioner of NLP, hypnotic practitioner, and hypnotic master practitioners. And we will may have some exceptions based on how many days are required.
Yes.
And we will talk this individually. Also, if you have done maybe NLP practitioner with non-society.
Yes, because you can assess their skills. Because really, we just need people to have a certain skill level so that we can actually then take them to the next level.
Exactly. So we need to have the skills, but also so many hours and days.
Yes, you do.
And then you will do 3 days with Tina, do this research work.
Yes.
Which is in English, obviously. And people who are not native speakers and they may not be so good in writing, we will need to find a way to translate it. Yeah.
Yes.
And then it's an exam.
And then there is a written exam. Yes. Yeah. Now you said that most of the people coming to the course will speak English.
Yes.
So the written exam can be in English. When we go to Italy to run this course, we do have an examiner in the UK that speaks Italian. So it may also be possible to find an examiner that speaks Slovenian.
Yes.
For those people that need to do the exam in Slovenian.
Yes. So the exam is. Tell us a little bit about the exam.
So the exam, there's a multiple choice paper. So you would be asked something about the hemispheric functioning of the brain, like the left brain and right brain, and you'd get A, B, or C as your answer. So you just tick the right one.
Yeah.
And then there's a short answer where one of the questions may be when inducing trance in your client, what is the best way to proceed? And you would just do just a very small paragraph to answer that one.
Wonderful.
And then there's a practical exam where the examiner will ask you to demonstrate a trance induction. So they may say, so this is your client, and your client wants to stop smoking. How are you going to proceed with your client? So you would actually explain to the examiner the protocols you would use, and then you would demonstrate the different trance inductions that you'd use.
Okay. So it's a long exam. How many hours usually?
Takes a day.
A full day exam.
It's a full day.
Yes.
Yeah. Well, it is not really. I mean, the first paper They say we should allow 2 hours, but most people finish it within an hour. It's really easy. They just tick the right answer. The second paper is usually finished within an hour and 20 minutes. And then it's just the practical exam, and it's just a matter of waiting for your turn to see the examiner.
Of course.
And then the practical exam takes about 20 minutes.
Wonderful. So...
and the examiner's really nice.
Okay. So I'm thinking about when you come in 2019 to Slovenia, the 3 days and the research work and then the exam, this will probably be some space in between.
There will be space in between. So I will come and I will do the 3 days, and then they will then have a couple of months to do their research, to do the assignments, and then you can arrange for the examiner to come in just for a day to set the exam.
Wonderful.
Yeah.
If there are any questions, because I know that we didn't announce this live video and so on. It was a surprise. You may ask us now, or you may email me all these questions that you have, and then, of course, I will ask Tina and provide you the best answer. But,
and we could even do this again. We can do it on the internet.
Of course, we can connect and do a shared video
and answer the questions.
All these questions that are now.
Yes,
but maybe it's a good start that we now start asking people to think about that and so on. I think the deep hip, so like a diploma of hypnotherapy, it's something that it's a great start for anyone who would like to become really a professional.
It is,
and also probably it's not only recognized in the UK.
No, it's recognized in Europe as well.
Wonderful.
Yeah.
Wonderful. If you have any questions, you can now maybe type in the comments, or send me an email, or send me a private message. Maybe Tina, because you are coming to Slovenia and you traveled in different places, and you've done this course in England as well. What are the issues or questions that people mostly ask, what are the topics that people are mostly interested in?
When the last time I did this course in Rome, and I'm going back to Rome at the end of this year as well to do another course. The last time I did this course in Rome, a lot of people were interested in the addiction side, because I think that is a huge problem in the worldwide at the moment. So from like stop smoking to cocaine addiction to alcohol addictions, and also the fertility side seems to be huge, and it seems to be worldwide. That there are issues with people nowadays, probably because women are waiting till they are older before they have their families, and sometimes this becomes a little bit more difficult the older that they are. But it's easier to overcome these issues when you use hypnosis. The other questions that came up last time I was in Rome.
What about kids? Hypnosis for kids?
Yes, was children, and because children are great hypnotic subjects. Although I must confess, most of the time it's the parents that need it, not the children.
So we are hypnotizing the wrong people.
Yeah, most of the time, because sometimes I get parents contact me because they have a 5-year-old that won't eat healthy food, and that always surprises me, because who's providing the food?
Yes.
Is the 5-year-old going shopping? No, it's the parent that needs the coaching, and a lot of the time that's what needs to happen.
So somebody who will finish the diploma and get certified with you, at the end of the day, they will need to notice if it's the parent who they need to hypnotize or is the child.
Or the child.
Yes.
Yeah, I mean, if I work with children, I always have the parents come as well, because I want to see the whole family unit.
Yes.
And how they communicate with each other. And sometimes it is more a case of educating the parent than hypnotizing the child.
Wonderful. There is one specialty that you have, Tina, for many years, and you have written a book about this, and it's about helping women
with pain control with their babies.
Yes,
yes,
pain control with the babies.
Yeah.
Tell us a little bit, how does this work?
Well, it started a long time ago when I was pregnant with my daughter, who's now 34. I didn't believe birth should be painful, and everybody was telling me it was going to really hurt, and I thought no. And actually I had a really easy time. And it was later when I started to learn hypnosis that I realized that I actually went into a trance. And then I found the work of this English doctor from 1940 something, where he found that women that had easy births, because there are always some women that have easy births. I mean, there are those that will tell you they were in labour and how awful it was. And there's always somebody that says, no, it was really easy. And these are the people that fascinated me, because we're all the same. We have the same hardware. So why is it some can do it and some can't? And this English doctor studied this, and he said, women who have easy births appear to be in a trance-like state. And I thought, but I'm a hypnotist. I can help people do this. So then I devised this whole program where I taught women how to access trance, and then they just had their babies without pain and really easily.
Wonderful, wonderful. So if someone is watching us and is expecting a baby or is planning to have a baby,
or planning a baby,
the technology that Tina has and the knowledge could be useful for you and helpful, of course. So I think since we surprised our audience,
we did. We'll have to come back and do
yes,
it again. And
we have to come back for questions. So now it's a good time for you to think about all the questions that we have for 2019. This is our goal and plan to bring Tina to Slovenia and to organize the first ever diploma in hypnotherapy.
And I'm really excited because I've never been to Slovenia. And I'm really excited. I want to come and see your country. Yeah,
Tina just asked me where Slovenia is geographically.
Yes, I'm terrible at geography.
Since you go to Italy, you'll see that we are a neighboring country, and from Rome or Milan, it's a little bit long drive, but still doable by car, so we can combine it with Italian group. And I invite you to ask questions, to write, to email me, and start thinking about, because this is equivalent to a bachelor's degree, and with the diploma you can also work worldwide, all over the place. And if you want to move to UK especially, you can do this a formal hypnotherapy job.
Yeah, you can. Yes.
Yeah. So nobody will ever stop you or ask you why are you doing therapies, because many times I teach my students when they finish NLP and when we finish hypnosis, that we are allowed to say that we are teaching, we are consulting, we are coaching, but we are not giving them any therapy.
Yeah.
So this is a different.
This is different because, in fact, I call the people that I see my clients, but people that have this qualification are entitled to call them patients. And a lot of the students that I have, they get their diploma and then they have patients, they don't have clients. Okay. But I just prefer to call them clients.
Okay. So wonderful. If we have no questions for tonight, I think we have done a great introduction to your
I hope so.
Future.
And I hope to be seeing some of you soon.
Yeah, so come and join us. Finish the courses that are necessary for you to be able to qualify. And also we talked about this a little bit before. If people don't finish NLP practitioner, master practitioner of NLP, hypnotic practitioner, hypnotic master practitioner, they may still come and attend.
Yes, they can.
They still can do
They can still do the course. They won't get a diploma. They'll get an attendance certificate.
Exactly. So you just get an attendance certificate. You get the knowledge, but you cannot work and use this title, which is it's incredible title, especially because we used to have those titles after we finished.
Okay.
Very similar to your title. Okay. So. Tina, thank you so much.
Thank you, and I hope to see some of you soon.
So, thank you everyone, and I will say just a few words in Slovenian.
Of course, please do, yes.
Jaz bi se vsem iskreno zahvalil, da ste nas gledali, da ste bili z nami. Jaz vas seveda vabim, da naredite praktik NLP-ja, mojster praktik NLP-ja, praktik hipnoze, mojster praktik hipnoze, in da bomo skupaj s Tino naredili ta specialen, poseben certifikat, ki bo edinstven, prvič v Sloveniji, ekvivalenten v bistvu dodiplomskemu študiju v Veliki Britaniji, in boste dobili naziv DYP, D, I in P, HIP, to je diplomiran hipnoterapeut In zaradi tega vas seveda vabim, da izkoristite to neverjetno priložnost. Tisti, ki ne znate dobro angleško ali pa se bojite tega, boste lahko seveda imeli izpit in celotno certifikacijo tudi v slovenskem jeziku, če najdemo, upam, da najdemo kakšnega, ki bo seveda ta ustni izpit naredil v slovenščini. Tako da se že veselim, da bom skupaj z vami, da boste neko novo znanje in neko novo tehnologijo prinesli v svoje življenje. Tukaj je Tina povedala, se boste lahko ogromno naučili, kako delati z odvisnostjo in kako postati boljši terapeuti. Hvala lepa, še enkrat preživite čaroben večer, upam, da je bilo to koristno, čudovit, čaroben dan, jutro, karkoli že, kadarkoli gledate. Tako da hvala lepa, bodite v cvetju.
Bye, ciao.